right, good afternoon, ladies and gentlemen. Welcome to our weekly media briefing update. We didn't have one last week because we had the budget votes at the legislature. So we are continuing this week. And the Premier is unable to join us today, but MEC Masuku and MEC Lisufi will be able to take you through the update of what we've been doing since the last time we had a briefing. I'm going to ask MEC Masuku to take you through all the areas of our intervention, and then MEC Lusufi will speak specifically about the education matters, and then of course we will take your questions. Right.
Thank you. Good morning or good afternoon, everyone, and also welcome to our weekly media brief, which is something that we have started since we began with our fight against the pandemic in March, where we able to give you what we have been able to do and what are the latest incidences and interventions that we have been up to lately. This is just a general slide that emphasizes the point on the 6 pillars that our response plan is based on, and it's something that has also been adapted nationally that continues to guide our command council. So the first point we'll deal with is the one on the comprehensive health response, which is the necessary one that we normally give. But now we are at a point where we have to go beyond the figures and the facts in terms of numbers, but now talk about our intervention plans and also the impact of the interventions that we have put into place. These are the general figures that have been released by the National Department, led by the Minister, and you will see that the numbers are continuously increasing, and Gauteng is actually fastly increasing its numbers, but well of its active cases and confirmed cases as of now. We are, in actual fact, in the second highest province in terms of confirmed cases, but we are the highest in terms of active cases in that place. So we'll demonstrate that actually when we go forward with the presentation. This slide just elaborates the picture, the previous slide, on the confirmed cases and the point that I made about Gauteng being the second, contributing 23% of all the cases in the country, and also contributing 38% of all the active cases in the country. Western Cape is it's second, followed by Eastern Cape with active cases. This is a situation that has occurred after you will see when we go through the different numbers as we go through the lockdowns, that how it has impacted on us as the province of Gauteng. But the number that we are seeing, the surge that we are seeing, it is an expected surge, which we have always been talking about, and we still have to get to what we say it's a peak. The peak being defined as when we have the highest number of the actual infections, which will continue in a period of a week to almost a month, where we won't be able to see any growth in that matter. This is also the picture about recoveries. Our recoveries are slowing down at the current moment. You will see from the last time when we met that our recoveries only are 10% of the general one that we have in the country. And Western Cape has got the highest number of recoveries. This is a function that we've always said that when you have the highest number of infected cases or confirmed cases, there will come a point, usually it's 14 weeks after it's 14 days after the confirmed cases have been that are actually considered as recovered and or as case closed. And it's how we actually look at the issues of recoveries. The other one is it's an issue which is I think it saddens all of us in the country, where we continue to lose our compatriots actually to the COVID-19 virus. And it's something that we need to guide ourselves, and we need to continue with our message that we've been putting across all the time, that we need to contribute as the population, as the community, as the society, to make sure that we slow down and actually interrupt the spread of COVID-19 in our land. And we want to actually pass our sincere condolences to the families of the compatriots, and also pay our gratitude to the healthcare workers who have been taking care of those who actually demised over COVID-19. This is a slide that we have seen. It continues to evolve over time, and we did indicate 2 weeks ago that we are worried with the active cases, since the active cases bisected the curve of recoveries. And this is what we are seeing. And this is also a function of the number of the confirmed cases that we are seeing. And we are actually looking at it and following it up quite appropriately. And we have put measures in that regard to try and contain. And as we have said, the all intention and objective of us is try to interrupt and slow down the spread and the spread and the transmission of the COVID-19. The deaths, they still have not been that significant, but we will demonstrate in this presentation how the deaths have actually increased and how they have actually contributed, as we welcome the MEC Masibuko Nonhlanhla. This is a slide. We normally make the comparative analysis of both the previous week and the current week that we are in. This is just sums up the numbers. You will see that from the 18th up to the 26th, we have a very significant number of confirmed cases. This slide just also talks to what I've been talking to in terms of the total number of positive cases that we are seeing per day, and it also allocated within the paradigm of the lockdown. You will see that level 5 and level 4 lockdown, we had very minimal positive cases as a province per day, which also just demonstrate and indicates how effective lockdown was in that regard, particularly for us as a province. And beginning from lockdown level 3, you see now the sudden increase of infected cases. And this is also a function of a whole lot of activities that have been opened up, particularly informal trading and all other actually businesses. It's something that the country and the province, we had to think about very closely and dedicatedly to make sure that we create a necessary balance between saving lives and also saving the economy. Because somehow we did accept the fact that the lockdown have got a very negative impact on the economy, but it has a very good impact on our healthcare and also on our ability to actually control the spread of the virus. So it's something that we are concerned about, and we are continuously engaging with the National Command Council and also in the Command Council of the province led by the Premier, where we want to make sure that we are continue to control and manage the spread of COVID-19. This slide also just succinctly puts it clearly how our numbers have been in terms of cases, and this is just per lockdown level, and you'll just see how the numbers have sharply went up under, level 3. So it's just an important fact that we need to emphasize here, that a balance had to be made, a balance have to be created, and again, it's so important that all of us as the citizenry of the country and of the province, we need to play a responsible role in making sure that we take part in in interrupting the spread. This is just also the regional breakdown of the cases in the province. Johannesburg still remains the highest, with the highest number of active cases and also confirmed cases. I think it's also a function that the number of people in Johannesburg, in terms of population, they are found within that region. And you'll see where we had a problem a month ago, where we also went to West Rand and descended there. You see the numbers there, they actually well contained as of now, and we are playing a very good role in that regard. So our attention is now focused in Johannesburg, and it's just the issue of containing and making sure that we're able to totally trace the contacts and also play a role. In this place, I would want to also indicate that we want to indicate that there we need to play a role in making sure that the communities themselves, they take an active interest in making sure that these numbers don't go up and they contribute towards the recoveries. It's still an important fact that we need to make sure that we do allocate our numbers appropriately and actually continuously to talk to our data. The point that I want to make about the data is that data will keeps updating all the time, and data will always be changing. So the numbers themselves, they will reflect the numbers as current, but maybe as of we speak now, they have actually even changed. So it's important that we keep that in our mind to make sure that we understand what we've been doing. So this is the current picture of the 24th of June this week, and you still see that the numbers, yes, are growing steadily across the province, but the one that has got the highest number still remains actually Johannesburg. This is the numbers that reflect the hotspots across the provinces in terms of sub-districts. The ones that have got the highest numbers of confirmed cases are all around Johannesburg, particularly Region F, which is the one that includes the inner city and Johannesburg South, and followed by Region E, which is where we are in the command center, which is the areas that have got a big problem. And when you look at across in Ekurhuleni, you also see that they do have some numbers that are actually going up in terms of confirmed cases. Of importance is that we need to focus on where we had problems before, and you see how steadily we have been able to maintain and contain the spread in those areas, particularly Tembisa in one area and the one that we saw in Mirafong. This is just the indication of the days in the last 7 days in terms of cases increase per sub-district. It's just the confirmation of the previous slide, and you'll see, and I think I've indicated the regions that are, the sub-districts that are a problem in this regard. This is a slide that we demonstrate our flu immunization actually program. By the way, it's important just to note that this slide might not change for a longer period because it works on the number of stock that we have, and this is what we have been able to give throughout, which is almost 285,000 flu vaccines that we've been given to the most vulnerable groups. This is the numbers on screening and testing. It just confirms that they continuously increase, and these are the figures of only the public sector actually screening that we are doing. And here we have to maintain that, actually mention here that we are looking at instances of screening, and one individual can be screened more than once in the process, and I'm certain here most of the public have been screened more than once, and they do count in that regard, and particularly in the areas where we require them to capture that data. This is the total number of the figures that we put up in terms of testing. You will realize that we have done a whole lot of child testing, and the bulk of the testing we've done is contributed by our community testing and screening, where we're focusing in our hotspots and focusing in areas of outbreaks, and it just indicates that. Here we also have to mention that we do have a backlog of over around 30,000 cases. We had an engagement with NHLS, and we are going to close up that backlog by the end of this current week. And by next week, when we report to you, we won't be having any backlog, and we will be actually reporting on all the current values that we have. This is just a slide that we continuously put across in terms of bed availability, but we do have an updated slide that gives us the numbers of beds that we have added in the public sector. The important aspect here is that the MOUs have been signed with all the private hospital groups in Gauteng, and those beds that we have put there are currently available. But it's important also to indicate that these beds are not necessarily empty, but they are available because there will always be somebody who occupies them, as we are still running other healthcare services, both in public and in private. But this is the number of beds that we have. So all along in June, we don't really have a shortage. In July, we have built on the capacity to do that work. We have also added this number of beds, and we indicate that all the planned beds are also going to be found in public. We are adding field hospitals, which we will give you a full detail on the progress on the construction of putting up the field hospitals. We have 5 areas where we are hoping that these field hospitals will be put up. Work has already started in Nasrec, and there was work that will be started by the South African National Defence Force in putting up the field hospitals. The principle of field hospitals is that it will only be for patients that require continuation of care, but not critical care. And that will be the first prize that we are using in terms of the objective and priorities, that the more sicker the patients will be taken care of in our hospitals, and then those who are now better just remaining to be seen or continuing some antibiotics or fluids, then they will be taken to field actual hospitals. This is just a slide that we demonstrate that the number of beds that we're putting up according to our clusters, George Mokari cluster, Christian Barakwana cluster, and also the hospital that we're refurbishing in Carltonville, which is almost, which is getting there in terms of completion. This is the number of patients that are in hospital as of the 24th. You will see that the number have actually increased from the last time we had this media brief, and currently we are sitting with over 67 patients who are on a ventilator, 248 patients who are on oxygen, but these patients are on high care and they are being treated in our ICU and high care units. And the general wards, they have that number that you see there. It's important also to note the point that the majority of our patients who have been admitted in the system, they are those who are still admitted in the private sector, and we do see the numbers increasing in the public sector. This is just an age analysis of the people who have died, and this is of 22. It doesn't include the latest 6 that we have added on the general statistics. The bulk of the patients who have demised and who lost the fight against the pandemic are between 50 and 79. And this is what we are actually demonstrating to the public in this space. This is also the analysis of the people that have died. The first pie chart there just explains the number of days that people have spent in hospital before they've passed on. You will see that in general, the number of people only spent the first and 2 days in maximum. And this is an indication that most of these patients come already being very sick and very ill, and it gives us more little chance for us to be able to assist them. And the other pie chart it just demonstrates that the comorbidities comorbidities that we have been talking about, they are quite a big factor, particularly diabetes and hypertension. And you see that lung disease also play a bigger factor, including diabetes usually is associated with an increased BMI, which is obesity. So comorbidities, they play a role in the fight, in the factor that influence our outcomes in terms of patients that get infected with COVID. So generally here we report on our public servants that have tested positive. As of now, out of 172 public servants, 113 in Gauteng, we have 924 who have tested positive since March, and this include public healthcare workers and educators. We are deeply saddened by the recent reports of losses of three of our healthcare workers, one in Yusuf Dadu Hospital in West Rand and two in Tanswart Laundry Services. And here we want also to pass our heartfelt condolences as the Gauteng government to the families and the colleagues of those who have actually demised. We are pretty much saddened with the loss of our healthcare workers. It's also important that when we have incidences of this nature, we do follow all the necessary protocols as prescribed by the World Health Organization and as prescribed by the Labour Department. And we are doing a whole lot of work in terms of getting to understand how the infections do happen within our facilities. Work has been done and concluded, and Helen Joseph will present the outcomes of that work. We'll also present the work that has been done and completed in Kopanong, just to indicate to the public how the healthcare workers get to be infected and whether it is of our great interest in that space. We also want to indicate, we have released a statement as the Department of Health about our mental care healthcare users who are in our facilities. We have continuously been monitoring them in making sure that we test and screen all of them, and this is a slide that we have been actually using. We also want to confirm that today and tomorrow we are finalizing the appointment of our mental review boards, which exist in all the 5 districts. We initiated the establishment of these boards after the Life as a Dimeni incident, and these boards help us in a greater way to make sure that these facilities where we put our patients and our mental health care users are actually up to scratch, and they live up to the safety standards and the care that they require. So the boards have already they finished their first term, so the ones that will appoint now will be starting their second term. And this is one way that we have done to improve our service in terms of mental health. And we have also made sure that these facilities do have the steering committees, the COVID-19 task teams, which have got all the relevant stakeholders. Daily screening of staff of patients does happen. And we also follow all the guidelines and SOP of all the, in terms of the management of COVID-19. And this is what we are doing. This is a slide that we demonstrate in terms of the stock in hand. You will see that the figures continuously rise, and some of the other aspects of PPE, they drop. It's an important thing that we always have to say we have adequate PPE. We won't have to say to anyone that we have enough, and we also have to make sure that the quality of what we are using is also of good quality, and it will protect our staff members. As we have said before, this is an aspect that will continuously procure, continuously make sure that we improve even on the usage, and also allow innovation in many instances that will give comfort and give safety to our healthcare workers. This is just the thing about it, and we'll cover, this is a slide on food security. This is just how, I think the Premier in the last 2 weeks, we did indicate to yourselves that we have passed the 1 million milestone in terms of food distribution, and I will then also pass the slide and also give over to MEC Lusufi to cover a few aspects that relate to the progress on reopening of schools. Thank you. MEC Lusufi.
Thank you so much, MEC Masuku, MEC Mazibugo, and Program Director Thabo Masebe. We are giving an update of where we are in terms of education since the reopening of schools in the last 2 weeks. We've got statistics as of 2 days ago, that is of 23rd of June, and we'll go through those particular details. We want to indicate that thus far, except our Elsen schools are our special schools, we are quite proud that majority of our schools have opened and are still operational. Obviously, with the conditions of COVID, we have been hit hard, and there are areas where we'll take you through, in particular, the numbers of those that have tested positive in terms of schools, that have tested, numbers of people that have tested positive, as well as the number of learners, the number of educators, and the number of our staff members. We've indicated that within the Elsen schools, that is the special schools, there are 4 schools that could not open due to infrastructure challenges. But majority of the schools that couldn't open within the Elsen schools is purely because they didn't have learners that need to come to the grades that we have identified. We also want to take you through the exact numbers of schools that we have within the public education system. There are 2,045 that opened, and of the 2,045 that we have, it's only almost 2,161 public schools that could not go through because of the challenges we've indicated. There are 116 schools, that is 5%, that are closed, and these are mainly due to matters of infrastructure and also matters related to water, electricity, and other related issues. The main issue that has hit majority of our schools is electricity. We're having a big challenge with Eskom. Eskom is exercising some electricity restrictions, and in some communities they affect schools. And because we are in a winter session, when it's too cold, unfortunately parents feel that they need to remove their children. In terms of independent schools, these are schools that we subsidize as government. There are 619 schools that opened out of 659. So there are only 24 schools that could not open, and majority of them that could not open are mainly schools where parents have decided not to pay school fees during the lockdown. And unfortunately, these schools cannot cope, and therefore they decided not to reopen until all the grades are allowed to come back. So of the 659 schools, only 619 came back, giving us 94% in terms of the number of schools that have opened within the independent schools. You might be aware that there are other popular private schools that have already closed as well, purely because of funding-related matters. If we move quickly to the COVID cases that has been reported on until the 23rd of June, unfortunately, we've got 176 schools that have been affected. Of those 176 schools, 58 learners tested positive, and 188 educators also tested positive. We are working very hard to ensure that those schools that have been affected, they are reopened, and the Department of Health is assisting us a lot there. And all those learners that have been affected, these are learners that were they didn't get the COVID within the school premises. These are the tests that we took when we identified them before they arrived within the school premises. And we requested them to test, and on the basis of those tests, we received 58 positives affecting learners and 188 affecting educators. We have received more than 1,000 applications from teachers across the province who claim that they've got mobilities, and therefore they cannot be in a position to continue to teach. This is a huge number if you take into consideration the number of educators that we have within our province. The next slides will take you through where all these figures that I was speaking about are spread across. You will see that the number of public ordinary schools that have COVID cases, the area that is hard hit, that has almost 28 schools that are closed, is Johannesburg Central. Johannesburg Central, it's a Soweto, Naturena area. That's where we are hard hit. And it's followed by Ekurhuleni South, where we've got 15 schools that are closed. Ekurhuleni South, it's our Katoras, Benoni, Boksburg area. That's where you'll see that we've got the second largest number of figures. And then they will also, I think the least province that we can safely declare it as a COVID-free in terms of the education sector, it's Tshwane North, where they've got 0 in terms of schools that are closed that were affected by COVID. These are the major challenges I took you through earlier on. The 3 areas where we have problems is water. There are areas where there is interruption of water supply in our communities purely because of electricity, one, but secondly, pressure. And because there is lack of pressure, there's no water in those areas. So I've spoken to the municipalities that are affected, and we want to thank those municipalities that have assisted us. The second area is the issue of sanitation as well. We've got challenges of sanitation, and we've already also spoken to the relevant authorities, and those authorities have assisted us as well. And the third issue is fencing, and the last part is the challenges that we have with Eskom. I think we want to emphasize that as the Gauteng Provincial Government, we really believe that Eskom is managing the issue of electricity management in our province in a manner that is not satisfactory. We really believe in some instances they are reckless, there's lack of consultation, and they are creating an environment where communities will revolt. You'll see that in the last few days, there have been many communities that have been protesting on the issue of electricity. And as the Gauteng government, we discussed this matter. We really believe that Eskom need to be sensitive, especially the period that we are in, and the need for us to fight this virus that we are faced. And there is a need for Eskom to be sensitive, to work together with us as government, rather than do the activities that are doing currently in switching off electricity in some of the communities that we are facing. This aspect is affecting schools as well, and that's the reason that we are flagging it, and we really believe it needs to be attended. If we have to sum up, when we open the schools, we've got 25 schools that could not open because of the challenges I've just alluded to. And when we went the next week, we reduced that number from 25 to 7. As we are speaking to you now, we only have 4 schools that have infrastructure challenges that are still open. Even if we have 4 schools, those learners are not at home. We've spread them at other schools that are nearby, so that there is no learner that is at home who's not learning purely because of the infrastructure challenges that we have highlighted. This is the summary of the COVID cases per area. As I've indicated, we've got 188 educators that are affected. And you can see that Johannesburg East, that is the east part of Johannesburg, Orange Farm and all those areas, is the highest in terms of teacher population, is 22, followed by Johannesburg North, which is the North Leaf and other part of that area. We've got 20 educators, but in total, there's 188 educators and 158 learners that are affected. Majority of our learners that are affected is Tshwane South, and that's where we have majority of learners that are affected by COVID. These are numbers of teachers that have applied purely because of comorbidities. They really believe that they cannot be in a position to teach. We've indicated that we've got a total number of 870. That is the schools that have between 1 and 5 educators, and the schools that have between 6 and 10 educators, there are 147. And those schools that have more than 10 educators that requested not to be allowed to come back to teach, there are 61. So these are the numbers of people that feel that they cannot come. In terms of learners that have coexisting sicknesses, We've got a total of 442 learners in schools where they are below 5%, and in schools where they are below 10%, we've got 10 learners. In schools where they are above 10%, we've got 4 learners. So in total, there are 442 learners that we really believe that we need immediate assistance because they've got coexisting diseases, and therefore, if they have to come back within the schooling environment, they will be affected. Currently, we are working on implementing the next stage. The next stage is to receive almost 1.3 million learners in our province on the 6th of July. We really believe that we are ready now. The last phase that we've just come out of grade 7 and grade 12 has given us experience, have given us information that has assisted us to know where we are. So we are ready to plan for the 6th of July. We've got a bigger number. There are 3 areas that we are working on. 1 is to add additional classrooms in terms of mobile classrooms. 2 is to do what we call is rotational learning, which simply means there will be learners that will come to school on Monday, Wednesday, and Friday, and there are others that will come on Tuesday, Thursday, and Saturday. But we've left this aspect to school so that schools can adjust it according to their own needs. The last aspect is what we call, which we are considering as a department, is shift learning, which simply means that you have some grades that will come on a Monday, and other grades will come on a Tuesday, and other grades will come on a Wednesday, other grades will come on a Thursday and a Friday. As we are saying, we've left this task to principals so that it can be school-driven and school-centered, and each and every school can give us the information that they believe it will suit them and choose the option that will suit them. We want to conclude by indeed announcing that this morning we started our online registration, a process that normally takes 3 months. We've reduced it to 1 month, opening today, closing midnight on the 24th of July. This morning we had the 3 minor glitches. The first one, our connectivity to the Home Affairs server, unfortunately, could not kick in when we wanted to kick in, but it has since been resolved. And the second thing is that because we are dealing with personal information, what we requested, just to be sure that the person that is applying is the same person that is having a learner within our schools, we introduced the OTP system, that is on-time system that will give you a message and then you use that number to log in. Unfortunately, majority of parents could not get that number. We had to override the system to remove that element. And immediately after removing those 2 glitches, we are proud that by 12:30 this afternoon, more than 105,000 applications went through successfully. And we want to thank parents that were patient and those that have applied. We really appreciate that. The system is still on, and we're encouraging parents to conclude the application. And those that have gone through difficulties, we sincerely apologize. We really believe that if they can just go back now, everything is smooth and everyone is happy. They're sending us nice messages. Thank you so much. I truly appreciate it.
All right, we will now take questions. Let's start with those here. Yeah, can we move the mic over there to Mangoba?
Okay, Mangoba Mchunu from ENCA. My question really is on the number of active cases and the fact that Gauteng is seemingly now surpassing even the Western Cape when it comes to these active cases. You have said, of course, that you are concerned as officials, but just to find out, what do you think is behind this spike in active cases and new infections? And secondly, what is the plan going forward in terms of dealing with this? Do you have enough beds? And yeah, that's basically it.
Okay. Is there another hand here? All right, then I'll read a few that we got on WhatsApp. I'll start with the questions from SABC TV News, Nozintombi Mia. One, what will be done to address the disturbing trend of companies that are forcing employees to continue to work after someone had tested positive in the workplace and simply not following protocols? What punitive measures are available against that company, and how can employees seek assistance? The second question from Nozintombi still, why are the numbers in Gauteng dramatically increasing since level 3? I think the MEC did speak briefly about that, but we'll be able to answer that question. And how will the government, the provincial government, deal with the issue of the shortage of beds in the province? Then we move on to the next question from Brumilda from Network 24. The question is about the cases in hospitals. If it is not covered in the briefing, it is covered already, but if the MEC wants to comment further on that, the question is simply how many patients are currently in private and public hospitals in the province, and how many are in ICU. That was indeed covered in the briefing. And then Graham Hoskin from Sunday Times, question to MEC Masuku. How will the provincial government ensure that the testing backlog is eradicated by the end of the week? Oh, did we give that deadline? Yeah. Oh. Have more testing kits been procured? And if so, where will they arrive? When will they arrive? And were any testing kits delivered to the Western Cape and Eastern Cape? And if so, when and what has been the impact of this on the testing requirements in Gauteng? Then, yeah, I think it's the same question from the same person. The next question is that what is the provincial government's testing protocol? Is it more widespread and community-based protocols, or is it more focused with testing only occurring in hospitals and of healthcare workers? And then, yeah, the last question again from Graham Hoskin to the MEC for Health. What are the measures that are put in place by the provincial government to contain active cases in the province? Okay, I hope this is not a repeat. Okay, still from Graham Hoskin. Please outline the type of medical beds that the province's field hospitals will be fitted with. How many staff will be assigned to these field hospitals? And then it says, will the beds in the field hospitals be fitted with oxygen supplies and other necessary medical equipment? And if not, what percentage of these beds will not be fitted with such equipment? Okay, quite a lot of questions. Okay, this one I think we've dealt with. I want to see if I missed one. There's one to education about the readiness for July 6 for the other grades that the MEC has spoken about. What is the state of readiness for schools come July 6? What are the challenges you expect? And how many schools have had to be closed since July 8 as a result of COVID-19? We have dealt with that one, but the MEC can comment further, of course. Then there's another question there, I don't see from whom. It says, or I think it's the same person. What are the challenges the Gauteng Department of Education expects when schools open and 1.3 million learners return to schools on July 6? It is the same question that was covered. I hope I have, okay, I just see another one now. This is a new set of questions, Kwara. Is the MEC worried about the next, this is from Jacob from Rapport. Is the MEC worried about the next 3 weeks and the spread of the virus? And he says some doctors have spoken about the next 3 weeks, saying they expect the worsening situation like in Italy and Spain. In an answer to the MPLs this week, you indicated that the Gauteng government expects a bed shortage of close to 7,000 critical beds in the province. How will this problem be addressed? And lastly, will the private hospitals have sufficient beds to avoid or to avail to the public sector? Yeah, I think these are the questions we will answer. I don't know who wants to start, MEC Lisufi and MEC Mazibuko. Is there nothing for you, MEC? Okay. I thought you would want to deal with the issue of compliance.
Oh, okay.
Thank you.
Thank you. Thank you so much, Thabo. Truly appreciate the questions. With the environment that we are in, I think it will be reckless if we can say we are 100% ready for the next phase that will start on the 6th of July. What we can say is that we have put the proper systems in place. In terms of PPEs, in terms of ensuring that there is enough space and that the educators are available, and also the basics are there, the basics being water, electricity, and also ensuring that we can offer the necessary sanitation services that are needed within the schooling environment. The numbers are huge. 1.3 million is quite a huge number. And that is why we have no choice but to go on a rotational mode. A rotational mode means that there will be learners that will come on a certain day, and there are grades that will come on a certain day of a week. We're also looking at the possibility, actually, of dividing the school calendar or the school attendance on the basis of gender. That is, the boys come on a Monday, girls come on a Tuesday. Boys come on a Wednesday, girls come. These are some of the possibilities that we are looking at. So that is why I'm saying to generally say we are ready. I think it will be a limitation of thought and approach, and it's very important that we are open-minded and find a way of dealing with these things. We are praying, and that is why I want to congratulate institutions like VETS and Department of Health with the kind of assistance and projects that they're trying to introduce to assist us as a department. We've done well thus far in terms of, if you check the number of schools that are available. We are also looking at the possibility of those schools that were closed before, that we need to reopen those schools. So we are working with the Department of Infrastructure. We are also checking the churches. There are some churches that are massive, that we can't use churches as well for purpose of teaching. But you know, a church and a school, the infrastructure is different because the other one is meant for worshiping, the other one is meant for learning. So we don't want to see us carrying blackboards or chalkboards into a church and something of that nature. But we've got all these possibilities that we're working on so that we can respond to those issues. Tabo, if you allow me, I'll briefly go back to the figures because they were asking about the figures that we have of learners that have tested positive and teachers that have tested positive. Those that run this, if you can assist me quickly, and I think we can share this information immediately. Yeah, it's here now, thanks. The figures are here. In terms of schools that were affected, and we are deliberately using the word schools affected, because some people use schools closed, because they can close for a certain period and come back, or a certain section of the school might be affected or be closed. So we're not speaking about closure of schools, but we're speaking about affected schools. So of the affected schools, the number is 176. Of learners that tested positive, the number is 58. Of the teachers that tested positive, the number is 188. And this is as of the 23rd of June. We wanted to emphasize that point. I'm told that I didn't get the figures right of the schools that opened. We indicated that we've got, in Gauteng, we've got 2,161 schools. Of the 2,161 schools, 2,045 opened, or they're still operational, and that gives us 95%. It's only 116 schools that were closed purely because of the issues that I've just raised of electricity, sanitation, and all other things. But to date, we've reduced that figure to 4. So there are only 4 schools that are remaining closed of that 116. Of the 4 schools that are remaining closed, learners have been spread across other neighboring schools. And this is mainly because of the issue of electricity and water, and as well as sanitation. Thank you so much. Thanks.
All purpose. It's for the hands and all other surfaces.
Yes.
Thank you, DDG Masebe and MEC Lusufi. I will start with the question from Jacob from our board on the shortage of beds. I think it will also talk to what Ms. Mia also asked about the hospitals. I think what we have done in terms of repurposing of our facilities is that in June and July, we are not anticipating any shortage of beds, but also to ascertain you that we have already a confirmation and the MOUs with the hospital groups in the province that their beds that are available will be given to us when we require them actually for our patients. And I also made a point that the majority of the patients who are hospitalized at the current rate and the current point, they are actually in our private hospitals, in our private facilities. And it's something that we are actually looking at. So it's important to say to you that also the capacity that we are building, or that is in the process of being built, is that we had opted for us to build more on our own facilities within our own yards in terms of repurposing of the wards. You know that we had already included over 400 new beds from the last time we had a discussion. And this is just only from repurposing of the existing wards that are there. The second part of our work is also to put up new wards, which the wards that we're talking about have got over 1,400 beds. These are the wards that will be in Kopanong, 300 in Kopanong Hospital, 500 at Chris Hani Baragwanath, 300 at George Mukhari, and 300 at actually Jubilee. These are beds that will be ready in August. And these are the ones that will be there permanently and we're going to use beyond the pandemic. The third leg of our intervention is now to put up and activate our field hospitals. And our field hospital will have to serve the purpose in terms of equipment. And the equipment that we're looking at, that's why I spoke about that the whole intention and objective would be about us having to stabilize patients, firstly in our own facilities, in ordinary hospitals, and then those who, by and large, will be in the field hospitals will require minor or actually moderate care. But oxygen is an important aspect of that actually management, and we are working on with these field hospitals and extra wards that we're putting in. We are also looking at the stocks and the availability of oxygen. So this is what we've been doing, and we'll be continuously reporting as we open them in the phased in and making sure that those beds are actually available. And yes, indeed, we do have an agreement with private, and we are also going to utilize the type of agreement that was signed between the private sector in terms of cost in this regard and the Western Cape government, which is already in place. The question from Sunday Times is the issue of the backlog. The backlog, it's only 30,000 specimens that we are going to test. We have received permission and concession from the NHLS to be able to retrieve them and take them to private laboratories who have the kits. So we are clear that with the provision that we have and with the availability of the kits in the private sector, we will be able to complete the backlog. And it's an agreement that we reached, and the specimens, as we are speaking, they've begun actually doing the testing, because we are also worried that we don't want to create an artificial surge in terms of the confirmed cases. And also, after we've done the backlog, we'll also give the public the age analysis of the tests that we've been done, the outcomes of the tests that we're going to do on the backlog, so that you understand, the public understand, and we also understand the age analysis of those who have been confirmed positive, how long they've been positive, and when the specimens were actually taken. So in all, we are going to use private laboratories capacity. It's not only the big five that have been used, we're also going to use other small black-owned companies which are already having the kits. Indeed, NHLS did provide a whole lot of support in terms of clearing the backlog in Western Cape and Free State and Eastern Cape. And now part of it is that in Gauteng they've already started, but we're also helping them in that regard to make sure that we don't get the backlog going forward. The issue of actually hospitals in terms of staff, we are in a process of, by the end of this month, which is June, we would have employed over 2,000 staff members in all categories, almost 1,004 nurses in this regard. By end of July, we would have reached over actually 7,000 employment. So this is the work that we are doing, and this is what has been happening, and the measures have been put in place in this space. The issue of the companies who force healthcare workers or workers to work after they found care, this is essentially a criminal case. It's a criminality because it's managed by the Act in the Labor Act, that the companies must have responsibility and occupational health responsibility to their employees. And we are also following up as a command center that we will establish a hotline that will help us to provide, so that every member of the public will be able to provide that information of such companies. But we have also now started working with the Labor Department to make sure that we are able to enforce some of the measures and some of the actual measures that we're talking about. Because some of the outbreaks that we are seeing, the mini outbreaks, they emanate from activities of companies in that regard. So we are working on it and continuously now in a transition towards the hotline and also strengthening the Labour Department ability. We are sending out teams to companies that are actually reported, and the number of those companies is increasing. But one thing that I need to say is that anyone who does that, any supervisor or owner of any company who forces their workers to work whilst they know that they have to go through a particular process of decontamination and also testing and tracing on even isolating those who are actually contacts. So that's what I will say. I'm not sure why people say it's surprising. It's an expected surge that we were expecting, in terms of the numbers, particularly in terms of moving down of the levels of lockdown. We all remember that when we started that the virus will continuously spread with increased activity. So it's important that as society, we also limit a number of activities that are unnecessary, and go to places where you have to go to an overcrowded space when it's unnecessary. It should be a trip that you take out. It should be for work. It should be for getting actually necessities. Now we see people organizing parties. We see people organizing actually gatherings, and that is something that we discourage totally, because that is the source where the spread will continue. So moving down in terms of levels doesn't mean that we have to now abandon, all the measures that we have been talking about in terms of social distancing, issue of the face cloth mask, the issue of sanitizing of hands, and also creating less crowded actually spaces with good ventilation. So these measures must continue to happen, and we will continue to increase our actually surveillance and our monitoring. Like I've said, these cases were expected that they will increase because of them actually, the moving and opening of the economy. And also we have seen that there's blatant disregard of regulations by the public, which is something that is also actually discouraging. But it's also important that the media and ourselves as leaders of the communities must be able to encourage that, in a sense, let's keep it in the way that will reduce the rate of the spread and will reduce and disrupt the transmission. I've spoken about the issue that relates to the beds. The plan is there. It's in motion. The beds, the extra field hospitals will be put out, particularly in the areas that we have spoken to, Nasrec, in Tshwane, around Soshanguve, or any other place in Tshwane. We also looking at putting one in Ekurhuleni in Sanaba Stadium, working with the municipality and the South African National Defence Force. So this is work that is in progress, and it's something that we are looking at. So the gap that we spoke about when we answered the question in Gauteng Provincial Legislature, Jacob, was a gap, or is it Sunday Times? Is a gap that we are talking to when only we reach the peak, which is around September. But we are quite confident that with all this repurposing the alternative building technology hospitals and field hospitals, we won't be getting any actual shortage of beds. But it's work in progress, and it all has got some other elements that measures and variables that we need to control. But by and large, I think this is what we are saying, and the Labour Department must come in and play a role in the space of monitoring and running of companies, because companies must contribute in a sense of working with us. We have also seen companies who don't even take steps and action to make sure that their employees are safe. They just, when somebody is positive or negative, they want the government to play the role alone. But we want companies, private sector, to come on board and also help us when there is a need, particularly when dealing with outbreaks in their own actually facilities. So in conclusion, I think it's important to say that COVID-19, as we have described it before, as it's described elsewhere, that is transmitted from person to person. We remind people once more that currently there is no cure. Our best bet is our immune system. So the only way to make sure that we prevent the transmission is to avoid physical contact. And we need to adhere to the lockdown regulations and practice the golden rules that we have spoken about of hand hygiene, good cough etiquette, and also wearing a cloth mask when you go into the public. That is also one form of creating social distance. These measures, they remain critical to slow down and disrupt the spread of the virus. We remain concerned about the cluster outbreaks, as we have indicated, such as in funerals. We've seen people even organizing what they call vicinons or aftertears, and this is a practice that is not encouraged, and it's something that we frown upon. And it might become very difficult for our police to be the ones that police that. It should be the community themselves that are able to police such. And we are also appealing once again to communities to remain extra cautious when organizing or attending such gatherings, particularly the funerals. But we need to avoid at all costs to organize or even attend parties, weddings, or even visiting family and friends. This is one of the bigger ways that contributes in the spreading of the virus. So it's an important thing. We've seen this trend that is coming up now, that people do organize parties. And once that is also happened, they even take videos to also indicate that they don't care about the lockdown measures. But we want to discourage and even discourage people who are thinking of organizing unnecessary gatherings, which are not essential. We know that in funerals we can't avoid, actually going into, and it's what we are calling upon, because this virus is upon us. The spread is going to continue, and it becomes all of us and all of us responsibility to play our part to make sure that we, in a real sense, slow down the rate of its transmission and of the spread, and also disrupt the spread. So it's important that we take all these precautionary measures into mind, and we need to play our part, and we need to stop the spread. Thank you for your attention.
All right, thank you very much. We're done.